Hello, everybody. Thank you for coming. First thing I want to say is thank you to Brightbod.com for having me here to talk about living with chronic disease. And my name is Julie Kohler. I'm a patient, not a doctor. If you have any medical questions, always refer to your physician. During the presentation, your mics are going to be muted. They'll be unmuted afterwards for questions and answers. And feel free to ask anything. You might want to keep a pen and paper nearby to write any questions down that you have. And if you think of anything after that, you can go to brightbod.com, record your question, and me or someone else will record an answer back, which is very neat. So today I'm going to talk about life without insurance and how to save money on your health care, which is a long talk. So let's get started. Okay. Okay. Let me make sure we're good. Okay. We're going to talk about what some options without health insurance are. And I know even if you have insurance, there's tons of questions. I know I still have some, and I learn something new every day. So I want to kind of divide the talk up a little bit because I don't know about you, but I have tons of questions. Some are on how to save money on my medications. What doctors can I go see if I don't have insurance? What kind of treatments and support can I find on a budget, even if you have insurance? And without insurance, who's in charge of your health care? It's a really good question. Okay. I want to start with medications and how can you save money on your meds? Really good question. I know most everybody knows about generics. Uh, Generics are always cheaper than getting a full price prescription. They're normally the same, although I understand that the fillers can be different, but they are required by the FDA to have the same active ingredient. So just something you want to keep in mind when the doctor writes the script, make sure he checks off that box that says generics are okay, because that's really important. First thing I want to address is what can your doctor do to help you save money on your medications? And you might not think of that right away when you're in the doctor's office, but there's actually several things that he can do. One, offices almost always have samples. Ask for the samples. Don't be afraid. I know when I'm diabetic, and there was a time I really needed help with my insulin. Went to my endocrinologist, and I just thought to ask, do you have any samples? They gave me enough samples for a year, which is a ton of help. So you never know. Sometimes those samples are just sitting in the cupboards with nowhere to go. So that's always good to ask. You might find your cost without insurance is cheaper than with insurance. Believe it or not, when you go to the pharmacy to pick up your script, ask what the cash price is, because there are some medications that are actually cheaper if you pay cash than the copay on insurance is. And of course, shop around, call everywhere. Look online if you can. Every pharmacy has a different price. Even if you have insurance, you have a different price at every pharmacy because they all have contracts with the insurance companies on how they're going to set up, what they're going to sell that med for. So shop around, call around. Don't be afraid to switch if you need to. I know places like Walmart has $4 scripts on a lot of prescriptions. So before you go and pay, a copay or full price, you might have a prescription that's common enough that it's a $4 script. Lots of hypertension prescriptions, diabetes prescriptions. You can get those at a discount. 90-day scripts. Ask your doctor for a 90-day script. There's no reason that he can't give that to you, even if he wants to see you. I mean, probably won't want to see you less than 90 days. So it's a good idea to ask for those. And, if you ask for a 90-day prescription for something that you've been taking for years with 4 refills, that's a year. That's a year. You really don't even have to go to your doctor if you don't want to. That's a ton of money saved. I know some doctors have you go back every month, but if you're honest with your doctor and you talk to your doctor, you might be able to work something out where you get prescription refills that will last you close to a year. Prescribing more than you need. That's a little tricky because you don't want to have a prescription bottle that doesn't have the right information on it. Like it says, you take 2, but you have enough in there for 4, or yeah. So, but some doctors will ask you, would it help you if I give you a prescription for twice as much because it'll last you twice as long? Depending on your relationship with your doctors, that is something you can do. I've had a doctor do that for me before. Get your refills while you're there. Some meds that you're going to take all the time, like diabetes meds, lupus meds, cholesterol meds. Like I said, there's no reason your doctor can't give it to you with refills. If you need other things your doctor can do for you, if you need like a handicap parking thing, you can print that out online from your DMV, bring that in. And so the doctor can be very helpful. Anywhere you can go for discount meds or free meds. Yeah, there is. There's lots of help out there, even if you have insurance or you don't have insurance. Does anybody remember Montel Williams and the bus that he drove in with the PPARX on it? That's Partnership for Prescription Assistance. And what they have is a giant database with all the pharmaceutical companies and all the medications. You type in your medication, and it'll tell you if there's a program or if that pharmaceutical company is offering assistance for that. And you can get financial assistance. You can get, it partially paid for or sometimes 100% paid for by the pharmaceutical company. And especially with new medications. They do that with new medications. So if you don't have insurance, but the newest medication came out, like a biological, and you want to try that, do check it out, because there's a good chance that there might be a program there that you can join. And it's really easy. I mean, they send you to the forms, you fill them out. Most of the time you have to bring them into your doctor when you're done filling them out. And then you just go to the pharmacy, and they usually give you a card that says how much you pay on it, or a discount card, and all the pharmacies take them. So there's that. There's needymeds.com. They do the same thing. They help find places where you can get your medication at a discount. And I want to talk about, can you go online? Can you get your medications from other countries? A lot of people from the U.S., I know you've heard of going to Canada to get them cheaper, or going online to get them at a discount. You can. You can, but what you want to do is, let me see if I can explain this good. Under federal law, it's legal. It's not legal to import prescription drugs into the U.S. unless you're the manufacturer, but the FDA has issued a guidance for consumers. If it's for personal use, it's okay. So you can take your prescription online and check with a Canadian pharmacy. PharmacyChecker.com is a good site where you can find out if the pharmacy that you're going to online is reputable, and you can see there's a giant difference in the cost of medications. So with a prescription, you can do that. It's called a coverage of personal importations, what the FDA has set up. So what they allow is a 90-day supply of some prescriptions and medical devices if you meet the following conditions. This is what they say. If it's used to treat a serious condition and there's not an effective treatment in the U.S. that you can go to right now or take right now, you won't be selling it or promoting it to others, that it doesn't represent an unreasonable risk, and that you affirm in writing that the drug is for your personal use. They say the quantity should not be more than a 3-month supply, and you have the name and the doctor who wrote the prescription on there, and the U.S. Customs should not give you a hard time. So as far as I know I've done it a couple times. I know friends who have done it, and I don't know anyone who's had any problems. There are some things to be aware of, though, and I want to mention in other countries, some drug names might be identical to drug names that are used here in the U.S., but the ingredients, including the active ingredient, might be different. One of those was called Flomax, and it's for an enlarged prostate, but the brand name is called Tamsulosin, and the active ingredient's called Flomax, and for them, it's in an anti-inflammatory, totally different medication. So you just want to be absolutely sure that you're getting the right medication. So, talk to the pharmacist up there. Keep in mind that you have to convert the cost of the drug, if it's in Canada or somewhere else, to U.S. currency. So it might not be dollar to dollar. And shipping charges might be higher because it's coming from outside the country. So you want to make sure you're using a legitimate pharmacy. You can go to PharmacyChecker.com, or there's another site called VIPPS. And they're really good, too, about letting you know that the pharmacy is reputable. So that's a big help. I don't know if anybody remembers the big deal that happened with EpiPen and the lawsuit where EpiPen, it's normally $300 for an EpiPen, which is the pen that you take during emergencies for anaphylactic shock. Well, the company here decided to charge $700 for it, and that turned into a very big deal. Now they're back to charging $300 for it, but that's one of the reasons that people were going to another country to get it. So you want to keep that in mind. Clinical trials. Clinical trials, there's 2 places you can go. I know the one in the U.S. is clinicaltrials.gov, and the universal one, international one, is CenterWatch. And both of them have a really big database. You can just type in what medication or what condition you're looking for a medication, and it will pop up a bunch of trials. They'll say if the trial is open, closed, if they're still taking people, what part of the trial they're in. It will tell you if it's a placebo trial. You kind of want to know that, because if you're wanting to try a new medication or biological, you want to know that, you might not want to do it if half of them are taking a placebo. So you might not want to be taking that risk with your health to take one. So there's always a risk with a clinical trial, but it is out there, and it does help other people who have the condition that you do. You're aiding to research, which is very cool. Okay. Our medications different prices at different pharmacies. Yes. Yes, there was an article I read the other day where, metformin, which is the, very common drug for diabetes, went from a $4 script to a $200 script. So even if it's generic, you have to shop. You have to call. You have to find out. You got to do the legwork. No one's going to do it for you. So you want to make sure you get on the ball with that. And in this section, I want to ask, what doctors can I go to if I don't have health insurance, or, my specialists aren't covered? So, can you get seen at a university medical center or hospital? Yeah. University medical centers are training hospitals. They're training centers. And there was a time where they were more expensive, but from what I understand now, and some other patients that I've talked to, they're cheaper. So you can get a good discount by going there, and a lot of attention. And, because there's people there who are learning. So, the doctor will come in your room with all his little followers who are learning from him, and they'll spell things out clearly for you, and it can be a really good experience. And this is a big one. Can you go online to see a doctor? How many of us have been tempted to go online to see a doctor? I know I have. I know it's hard for me to go outside. I know people who aren't very mobile. I know sometimes when you don't need a physical examination, that going online is a terrific, wonderful experience, and it's affordable. So I checked around, and most of the online places that I looked at were affordable, about $75 in average to see a doctor. And you ask a question. I mean, you're limited. You can't have a physical examination, but sometimes you don't need one. Sometimes, you can say, look at my rash, you're on Skype, or you've got a UTI, or, a cold, and they can prescribe. They can send the e-fax right into your pharmacy with a prescription. It's a really good alternative. And while you're paying maybe like $130 if you pay cash at an urgent care, versus not as much for going online. And there are lots of choices now. There are tons of apps. There's Brightbot.com will have one. There's Doctor on Demand. I know that MD Live. I mean, they're popping up all over the place. And telemedicine and telehealth, from what I understand, are really two different terms, although they get kind of used for the same thing. I think telemedicine is just, when you hear that, it's just a broader term for any kind of online interactive medical help that you can get, whether you're in a forum, or you're buying some medical equipment, or you're talking to a medical professional. And that would be telehealth. And then telemedicine, they kind of use more often when you're talking to a physician. There's anything online these days that you can do, from digitally connecting with sensors to, where they connect to your heart rate. There are doctors right now that have sensors that they can connect to you to know your heart rate. They can monitor their patients from their office. And there's everything from that these days to, just going online and saying, doctor, I have a cold. So tons of choices. The degree and the type that you're looking for depend on the cost, what's available, and what you need. So, like I said, they're very reasonable. About, from when I found, about $75. They can e-fax in a prescription. Really cool stuff. Really convenient. Great for people who can't get around really well and people who are busy. And they're a little bit cheaper than an urgent care, from what I see. Okay. And I wanted to ask, should I go to an ER or to an urgent care? And the reason was, well, I think most everybody knows, uh, public hospitals are funded by local, state, and federal funds. They can't turn anyone away. So if you go to the ER, they have to see you. Private hospitals don't. And urgent care clinics are reasonable. They're approximately 80% less in the cost than going to an ER. And a lot of urgent cares have the same type of equipment. So going there is a really good alternative. Kind of knowing the difference between when to go to the ER and when to go to the urgent care can save you money. Any kind of severe breathing problem or heart problem, you want to go to the ER. But flu, ear infections, even like a sprained ankle or so, an urgent care is a really good place to do that because they can really help. So you don't want to take a chance with your health, but then you don't want to pay, emergency room costs if you're going to pay it. So good to know. Free clinics. Free clinics are a really good option to be seen at a discount because they work on a sliding scale. So depending on what your income is, you can get a really good discount there, and they have decent doctors. So I think that they take you on a walk-in basis too. So you want to check, where your local free clinics are. Okay. Okay. Concierge medicine. Has anybody remember the movie with Jack Nicholson called As Good as It Gets? Well, he was this rich guy, and he met this woman. She had a really sick kid, and he wanted to help her and the kid. So he was taking care of the kid's health. The doctor comes and knocks on their door with their lab supplies to do the blood work. And she's like, "What's this?" So that's a concierge medicine. In the past, it ranges. It can be like 13,000 a year, 15,000 a year. I mean, it can be very, very expensive, and it used to be very, very expensive in the past. But more and more health groups and doctor groups are are doing concierge medicine, and this way they can, what it is, you pay a fee up front. So like some of them work for, let's say, $200 a month. You pay that, and when you need to get seen, you get seen. You don't have to wait 3 weeks for an appointment or 4 weeks. But you do need to remember that a lot of the times the labs and any kind of testing like MRIs are extra. So it's very convenient. Used to be very, very expensive, still is for some people who can afford it. But doctors these days are starting to do it more and more. So you may find like Banner or Mayo, where they have a group of doctors together who are working with concierge, and it's something to look into. It is. I mean, they work with families, and it's an option. If you don't have insurance, it's a decent option. $150, $200 a month, and you can bring you or anyone in your family in. So it can be helpful. And what kinds of treatments and support can you find on a budget? And this is my favorite subject because online and the internet has opened up a gigantic world of support for, especially for people with health conditions. I think that everybody pretty much knows that other patients who have the same condition you have can be very smart with suggestions on how to help you and how to treat certain illnesses. So going to support groups and belonging to them online is huge. What if you just have a medical question and not an emergency? Like I said before, apps, there's tons, there's dozens and dozens of medical apps, and many of them connect to medical professionals. I know that what they're doing at Brightbot, I gotta be honest, it's just, to me, it's cooler than what I see at other places because it's a video question and answer. And advice is everything when you're sick. So, I mean, if it's not an emergency and you need a professional opinion or another patient opinion, online is a great place to go. Medical equipment and how to use it. I know, for example, I have neuropathy. I've got pretty bad neuropathy I've had for maybe 20 years or so. And I've tried everything, including TENS machines and other orthotic supports that you can use at home. You don't need a doctor for that. You don't need to spend money for that. You know you need the medical equipment. If you don't have insurance, you need to find somewhere to get it. You can get that stuff online. Other advice on how to use it, you can ask other people who use the same equipment in support groups. You can use the apps and go to medical places where you ask a question and get answers from nurses that are cheaper than asking doctors. There's a lot of things. You can call the emergency room, which I know I've done plenty of times, and talk to the nurses. What about this? How do I use this? This broke. And they're very helpful. So instead of having to pay an arm and a leg for, a visit, and I don't know if I mentioned before, cash visits. A lot of doctors give discounts for cash, so I don't want to forget that. And what can you learn from a support group? Everything. Because there's a support group online these days, whether it's Facebook or web or WebMD or Brightbot or Banner or Mayo. There's support groups everywhere with patients, and there's a lot of support groups that have doctors that pop in. So you can ask even a specialist a question and maybe get an answer. But patients who are like you with the same condition are always helpful. Support groups have forums. Going to a forum and where you write a question and then somebody answers you, that's helpful. That's great. I mean, you can't do better than talking to other people who are going through the same thing as you. So that's a really, really good way, because when you're in charge of your own health care, you have to make it work. You have to put the pieces together by yourself. So support is everything. As far as cost goes for labs and diagnostic tests, they are not the same everywhere. Costs are different everywhere, from Simon Medical to any other lab. The price is going to change, and it can be drastically different. There was a study done the other day where going to get a test done at one hospital was $15,000, and getting it done at another lab was $1,500. No kidding. So you want to shop, you want to call, you want to find out where, you might even have insurance, and your insurance copay or co-insurance for a diagnostic test like an MRI or a CAT scan is more than if you were to pay cash. And they usually always discount the cash price. If you want to know what the costs are, you can ask other people. You can go to a place called healthcarebluebook.com because they believe in the transparency, and they're really good about posting what prices are for different kinds of procedures and diagnostic testing. So you can see if you're paying fair price. Now this one is huge. What is a patient advocate? And the reason I want to talk about that is because everybody needs help figuring out how to take care of their health. If you're at the hospital and you see a patient advocate there, usually a doctor or a nurse will be the one to send a patient advocate to you. They may be there to help you navigate your medical condition and figure out what's happening to you and what procedures you're being given. They may be there to help you find a homeless shelter or a drug treatment program. When you go to a hospital, that's the kind of help that a patient advocate will give you. They're social workers usually. They also provide patient education on treatment options, and they help coordinate services needed after you're discharged. So like medical equipment. So that's pretty helpful. So if you're at the hospital, you want to ask about that and how you can save money. So hopefully they know. Then there's the patient advocate. There's three kinds. There's the kind at the hospital, there's the kind that you hire, and I think everybody knows what the last one is. The last one is you. Because lots of times you're in charge. Now that you can hire a patient advocate, they will coordinate care. They'll do in-depth clinical research. And from what I've read, a lot of doctors are starting this as a specialty. So they still practice, but they also work as patient advocates, and they can make anywhere from between $150 to $400 an hour. But what they do is they go over what your treatment is, your condition is. They find you specialists that they think would be best for you. They coordinate your care. They help you navigate through if it's insurance or if you're paying out of pocket, what the best price is. And the problem with them, the issue with them is there's no certification for them. So if it's not a doctor, you kind of want to ask them like who they've helped before and figure out if, you trust them and they would be right for you. And you can go to a place called patientadvocate.org. And I know that they have a bunch of outsources that talk about that. They save patients a lot of stress and time, and they can save money. Some of them will even help you sign up for Social Security. So you can see that they come from all different areas of medicine, but they're there to help you. And if you don't have one and you don't afford one, then who's in charge of your health care? That would be you. So you want to be the person who takes care of everything. So I'm going to kind of go through some stuff I know I have before. You just want to make sure that in order to get the best prices for things, that you're organized, that you're ready, so that when you go to a doctor, you're not going to waste their time. You're not going to need to go 5 times. You're going to go prepared. You're going to bring your records. You're going to bring an overview, which something that has your doctors and your medications and your conditions on, so that when you share your information, it's thorough. That way you don't waste your money going to a doctor 5 times for the same thing. You go once, and this is how you keep, if you have more than one doctor, and you're in charge of your health care, this is how you keep them together. You keep them organized by keeping your records and bringing a copy of everything that changes, your medication, your doctors, their contact information with you to give to every doctor that you see. Mobile applications can help you. They can save you money getting organized. They can help you find equipment and places to go for support, a way to keep track of your appointments, all that kind of stuff. And really just go to the app store and start typing in any kind of health condition you want, and you'll find a couple dozen apps, and play with them and find the one you like. I saw that Breitbart has an app, and it looks like it would be really cool. It's going to have a whole lot of stuff on it. What medical records should you keep? All of them. Make sure all your doctors get a copy of your overview. They don't have to have a copy of every single test result that you have. They can, if you want, if it's relevant, but you make sure you have it, because you don't want to spend extra money having to go back and pay for a lab report. So you are entitled to it. Just go in, ask for it. You may have to sign a paper, but that belongs to you. And same thing, that's what you can do to be prepared for emergencies. Real quick, you want to have that done to save you time and money in the long run. Dinners that are ready to go, your medications organized, a living will, anything that you can think of that will make life while you're sick easier. What can you do at home? Some of the equipment that a doctor suggests that you have that you can get online, like the TENS machine, like exercise equipment, orthotics. You can get those online and you can use them at home. You don't need an expensive doctor appointment to exercise at home and try preventative health and to do what you can. Follow your doctor's orders to keep healthy. Simple as that sounds, I know a ton of people who do not do that. Take the medications when you're supposed to. If you don't think, if you feel like you need a change, then it's time to see the doctor. Don't forget to take your pills, get plenty of sleep, rest, all the common sense things that you can do to make life with a chronic disease easier, because the less you have to go to the doctor, the cheaper it's going to be. And okay, that concludes the presentation, and let's do some Q&A. Questions?
Julie.
Yeah.
I am kind of old-fashioned. How good are the online doctors?
You'd be surprised. You know, they use Skype, just like we're talking right now.
Uh-huh.
They do that too. And they'll ask you the same questions as if you were in their office. It would be the same, all except for a physical exam. They're really great. I mean, I talked to a brain specialist across the country once on Skype to see if I would be a right kind of patient for him and he would be the right kind of surgeon for me. And he was fantastic. I had a 20-minute Skype conversation with him, and we had it all figured out by the end of 20 minutes on what we were going to do and, you know, how we were going to get it organized and if he was the right doctor. It's just like sitting down with your doctor. I'm going to, you know, I don't think every doctor is going to be great, but most of them are. They know they're talking to a patient just like I'm talking to you right now, and they're going to want to do what they can to help you. I don't think that they can help you with everything, but there are a lot of things that they can do without a physical exam. So you're not that old-fashioned. You're on here talking to me right now. So you can talk to your doctor just like that too.
Next question. You also mentioned that some places metformin went up from $4 to $200.
Yeah.
My husband gets his metformin free.
That's great. That's great. I don't know. I don't get mine free, but I can get it for $4, you know, if I want to. But I know that there are private pharmacies that do charge that, and that the prices are all over the place. So good for your husband. I'm really glad you found a place like that. Where was it? Yeah,
It's the Publix pharmacy in Florida.
that's great. That's good to know.
Yeah.
Yeah, that's like a question and answer thing. Where if you just went somewhere and you asked support, where can I go to get it? Just like you told me, I would learn right from you to go to Publix if I was
Yeah.
in Florida. So that's really good. That's excellent. But yeah, you want to shop around because the prices are different everywhere.
Okay, thank you.
Julie, I got a question. Julie,
Yes.
I got a question. To follow up on that first question, to the telemedicine and those other online type services, you would have had to have a prior, like, face-to-face relationship with a health professional for them to prescribe medication for you, though, right?
Right, you don't. But not all prescribe medication. So you want to find out first that they're a doctor. If you need medication, that they're a doctor that prescribes it. And some only prescribe certain medications, like they won't prescribe opiates or pain medication, but they'll prescribe anything else. So
You mean
you want to,
even without having met you or examined you?
yeah, like if it's an ear infection or a cold or a UTI, and you've had them before and they've never met you before, but you describe the symptoms to them, yeah, there are doctors that will do that.
Okay. Another question. You mentioned about private pharmacies before, and I've seen a bunch of them springing up in my area here in the Tampa area. And are they, I mean, how competitive are they with, say, like the Walgreens and the CVS's and things like that?
I don't know about in Florida. I'm in Arizona. It's 119 today. But they're not very competitive because they can't be. They don't have the contracts with the pharmaceutical companies and insurance companies, I would think, to get the medicines as cheap as some of the places like Walmart and Walgreens and Publix and all that do. In my experience, they've been more expensive unless you have insurance, and then they're pretty close to some of the other pharmacies.
Okay.
Yeah.
And last question. Would you consider like eBay and Amazon a decent place to get medical equipment?
Oh, that's a good question. Yeah, it depends what it is. Yeah, I would. I know there are other places that do it. I bought stuff on Amazon before. I have plantar fasciitis, and I've gotten a boot for my foot 3 or 4 times from Amazon. And I know that Breitbart's going to have a really nice medical equipment marketplace. And yeah, if it's not something, really personal, or yeah, I'd
Yeah.
buy medical equipment online.
Great. Thank you.
These doctors come from?
What's that?
Where do these doctors come from?
The ones online?
Yes.
They work at all over doctors. I know that there are companies who recruit them to work on websites. I know that some places like Banner have doctors that work online at some of these places. So from what I've seen, they're doctors in the United States. So I don't know that there's any international doctors on there to worry about. But that's a good question. You want to ask before you do it, I would.
Right.
Yeah.
I know you said that the doctors he talks to you online. It doesn't do an actual physical examination.
Right.
But what if your symptoms are like an ear infection, but in the end, he's prescribing something that's for an ear infection, but in the end, that's not what it is? I mean, how good is something like that?
Yeah, well, if you've had ear infections before, then he can reasonably say, I would think that it's an ear infection. If you haven't, he gives you medicine for an ear infection and it doesn't work, I would say you could call him back, go back on and say it doesn't work, or I don't know, I guess, I don't know if they have guarantees for that or not. I haven't had that experience. If they're wrong,
Yeah, because if it's the ear that's bothering you, but
yeah.
remember it's the ear, nose, and throat. So there could be a connection there. I'm just curious.
Yeah. I think that they're really much more helpful when it comes to stuff that you kind of already know what it is, or it's pretty simple. If it's complicated, probably they would refer you to see someone in person where they could physically examine you. But if you get ear infections every month and you're tired of going to the doctor and all you need is your prescription and you can't get a refill, online is a good place to go.
Okay, thank you.
Sure.
I wanted to go back to that question about the doctors. Who regulates them? The online doctors, do they, is there a organization or something? I mean, do they have to be registered with a group or something to be able to do this?
Wow, is that a good question? I wish I knew the answer to that. I know that there are websites where you can go to check which ones are reputable, but I don't know of any regulations. I don't know. I honestly don't know, and that is a really good question.
Because they could say they have these qualifications and they could be fakes. I don't know, and they're giving advice.
Yeah, that's frightening.
There's nobody to say that person is really genuine because he's not registered, let's say, with a group or agency or someplace that can vouch for them.
Yeah, well, you want to go to someplace you trust, and that's why, if you go to Banner or WebMD or something like that, they're going to stand behind who they've got working there, what doctors they have there. So you want to go to a reputable place. You don't want to go to, the Mexican online fiesta doctors. Yeah, you want to go somewhere trustworthy.
Okay. Thank you.
Yeah.
Is it always necessary for a patient to have a patient advocate, or is it only like certain instances, like maybe if they can't speak for themselves or something like that?
No, you always need one, and it better be you if you don't have one, because there's nobody else who's going to do it for you. Family's great, but somebody's got to keep your health organized. Even if you're not complicated patient, if you don't have insurance, because they keep everything there, insurance knows who's your doctors, where have you been, what tests that you've had. Without that, you don't have that. So you have to do it. So you better be keeping a record of where you're going, who you're seeing, what tests you had, what the results were, what medicines you're on. Because the more you have that, the less money it's going to cost you when you need help. So you need to be your own advocate. Even if you have insurance, I would suggest it. What these doctors are doing, being able to refer you to the best surgeon they know if you need a back surgery, let's say, and that's all great. But that's research that you can do too. So there's no reason that you can't at least keep your health organized on your own and be your own advocate.
If I wanted to buy inexpensive medication from Canada, let's say, or some other country, what is the first step? Or what can you outline the process for me?
Yeah. You get your prescription. You can either have the doctor give the prescription to you physically, or he can actually send it to the pharmacy these days. But it's probably better if you have it and take care of it, because some doctors won't mess with it. You take the prescription, and when you go to the website, you can either fax it to them, you can scan it to them, you can mail it to them, and they get the prescription, they fill it, they mail it back to you with shipping charges, and that's how it works. It's just like buying, just like getting your medication online from Walgreens, where they ship it out to you. It's sort of the same process.
And there is an attestation or an affirmation involved also?
No, I have never had one, and I've gotten prescriptions from Canada and other countries, and I've never ever had to deal with that.
Related question, but before you were saying that the medication has to be for you and you alone. You can't sell it, and you went down this list. What was that regarding?
That's the rules from the FDA. Because it's technically not legal to buy or to get your prescription out of the country, they came up with guidelines. And those guidelines are that the prescription is for you and that it's not more than a 90-day supply and that you're not going to sell it. Just so you know that as long as you do those things, you should not get in any trouble.
Okay. Thank you very much.
Okay. Well, thank you everybody for coming. I really appreciate it, and have a good day.
Thank
night.
you. Good night.